we're just going to keep rolling with our innovation today. We're talking a lot about how going upstream pays off, and I'm really excited to introduce this next group. Aubrey, if you'll get us ready for our slides, I'm really looking forward to hearing about what happens when we think about problems early.
The floor is yours.
Okay. Okay, can everybody hear me okay? Okay, so good morning, everyone. We are Keep Calm and Pull the Lever of Change, North Carolina, and our project is titled Mind the Gap, Strengthening the Primary Care Pipeline. And our group consists of me, Jennifer Dabbs, Dr. John Rusher, and Quincy Jones. Next slide, please. So for our project, we focused we started with Health Carolina 2030 for guidance. Healthy North Carolina is in its 4th decade as it works to promote the overall health of North Carolinians, which, as we saw earlier, was also a stated goal of the North Carolina Medical Society. Next slide, please. Okay, so we focused on Health Indicator 17, the primary care workforce, and you saw this graph earlier. And so as we can see, access to primary care directly correlates to fewer healthcare disparities and better health outcomes across the entire community. 1 to 1,500 primary care provider to population ratio is the recommended ratio. As of right now, 38 counties do not have an adequate primary care provider to patient ratio, including 6 counties having a greater than 1 to 3,000 ratio, and Franklin County, as we saw earlier, with a ratio of 1 to 6,278. Next slide, please. So Health Indicator 17 aims to improve the ratio of the primary care providers to the populations. For counties that cannot achieve the optimal ratio, the goal is to decrease the ratio by 25%. One way of doing this that has been highlighted by Healthy North Carolina with pipeline programs in rural areas to target high school and college kids. Next slide, please. Now, why is the pipeline so important? I'd like to call out this amazing rural physician that some of us were fortunate to meet with on Friday for a site visit. This is Karen Smith, and just as tireless as she is, I can tell you that the permission to include her in this presentation, the reply came in at 12:04 a.m., so she just does not stop. She is a family physician in Hope County, North Carolina. And when she started practicing in Hope County, there were only 3 physicians in the area. All were over the age of 65. And she has quite a few stories, and she sees all ages from newborn to 107 years old, and she's even prepared to deliver a baby if necessary. Another thing that is amazing is no one is turned away, whether it is a walk-in or an inability to pay, and she calls that out across her website multiple times, and even to maybe slight annoyance of her husband and staff, she sees everybody who shows up for the day. She does not turn anyone away. She's truly an amazing physician, and this is even covering half of what she does. But the big question is, Dr. Smith has been practicing since 1992. And the big question is, when she even said in her presentation, who is going to replace her when she retires? Where is that pipeline? Because the community definitely has a need. Next slide, please.
Great, thank you. So yeah, we are really grateful to Dr. Smith for allowing us to share her story. And it's really compelling when we think about our pipeline problem in North Carolina. Who is going to step in and fill the shoes of providers like her when she retires? This is particularly pertinent when we think about our rural counties, as Jennifer shared. Ideally, who we want to fill those shoes are people from those communities who will go and get trained and then go back to those communities. We want the people whose values and interests align with the work of those professions. And so as we thought about kind of our answer to the pipeline problem, it's really a long game. It's not something that's going to be solved in the very near future. Next slide, please. So we wanted to talk briefly about some of the gaps in the North Carolina pipeline to the health professions, and then we'll share with you a bit about our ideas about how to innovate and potentially address some of those problems. So one is that we don't typically reach students until late high school or early college, and oftentimes by that point they have begun on a certain trajectory that might limit their coursework, might limit options for college or potentially beyond. We wanted to generate interest in students who weren't already interested. So as we think about, I'm sorry, am I getting feedback? Okay.
Perfect.
Okay, so we wanted to generate interest in students who weren't already interested in those health professions, right? So there's already a pool of students out there who know they want to go and be a doctor or a nurse, but there's a whole pool of other individuals out there who may not have envisioned themselves in those roles. We wanted to think about one of the problems in the pipeline is that there may be professions that people aren't familiar with. I think growing up, most people know what doctors do and what nurses do, but they may not know what PTs do or PAs or NPs. I can share from my own experience that I did not know what a PA was at the point that I graduated from college, which obviously later became my career path. As we've heard in other presentations this morning, we have some really rural and remote parts of our state. And some of our current pipeline programs may not potentially reach those students out in Hope County or Haywood County in the mountains or Passaquoddy out there on the Outer Banks. And so that's one of the current gaps in our pipeline. And then finally, one of the really important needs that we have in North Carolina is to recruit a workforce that is representative of the population that we have here in North Carolina. So we have a significant number of people who are educationally or economically disadvantaged. They may be the first to go to college. We have a large population of individuals from racial or ethnic backgrounds that historically have been underrepresented in the health professions. And one of the gaps in our current pipeline is really figuring out how do we get our future healthcare workforce to look like the populations that they serve, which is one key to addressing health disparities. Next slide, please. So we took a look at the existing pipelines in North Carolina, and I want to mention that our project really focused on strengthening these pipelines and certainly not on replacing them because we have some really great pipelines in North Carolina. As you can see here, some of them are highlighted. Many of them are affiliated with academic institutions. They largely target high school or college students and largely target students with existing interests in healthcare professions. Another kind of key component of the existing pipelines is that many of them typically target physicians. And while this is arguably very important in our state, there are a whole host of other health professions that we also need to fill. Next slide, please. So I wanted to share excuse me, one specific example of a pipeline project in North Carolina. This is a really great one out of UNC Chapel Hill. This is the Health Affairs Pipeline Partnership Initiative, or HAPI. This program targets pre-college and college students, and it's a partnership with our area health education centers, which is such an important aspect of educating our health professions students in North Carolina and our healthcare professions professionals, quite honestly. This particular program uses interdisciplinary health professions graduate students, and they put on workshops, they perform outreach, and they actually take some weekend roadshows where they'll go to different locations upon request and kind of provide informational sessions about their professions. This particular program really focuses on preparing students to come to programs at UNC. And so I share this. It's an excellent pipeline program, but one of the limitations of this is that you have to know about it. And so if you're at a school out in Hope County, that high school has to request the students come out, and then they have to have a group of interested students large enough. Finally, as I mentioned before, one of the limitations is that it only hits the students who are already interested, right? The ones that would attend a session anyway, and that from a geographic perspective could also reach the location of such a session. Next slide, please. So as we thought about our project and how to innovate and add value to what's already existing in the North Carolina pipeline programs, we thought about targeting students at a younger age. So we really wanted to target middle school students before they had set on that trajectory, right? Before they limited potentially their science and math courses that they would take in high school and then beyond. Another goal of our project was really to broaden the reach to all students. So not just to hit those students that already have an existing interest in the health professions, but for all students to gain exposure and for them to learn about the different health professions that exist. Another aspect of our project was to create a virtual format so that it could be deployed at the convenience of teachers, potentially in science classes or after school programs at their convenience, and that everyone would have access to them. And then finally, as I mentioned previously, we wanted to ensure that our project included representation of those underrepresented groups so that students could envision, they could see themselves as future healthcare providers. Next slide, please. And I'll turn it over to Dr. Rusher.
So I first want to reiterate that our goal is to introduce to the 8th grader, middle schooler, the opportunities not just for a physician, but for all primary care providers, including nurse practitioners, PAs, physical and occupational therapists. And so in implementing this, we did decide to make our model from the PA educational plan. And so fortunately, Quincy is a professor at the Duke PA program and was able to do a little research with her PA students and talk about the possibility of creating this type of educational forum as maybe even part of their community service obligation as they're going through PA school. We also did a little research with 8th graders to see who not only are much more savvy in social media than I am personally, and many of us are in that generation, and try to understand what they want to know and what they want to ask. And so fortunately also, Jennifer has a 7th grader, Quincy has an 8th grader at home, and I've seen just a few teenagers in my 20 years of practice. So we were able to glean some good information about what might pique the interest of an 8th grader as to this whole world of potential health care and health information. And so thinking about producing a age-appropriate video, a YouTube with some cool Snapchat teasers, because we're going to have their attention for about 5 minutes on a social media type platform. And so doing some type of interview informally where a middle school student could look and emulate what they're seeing on the video of other 8th graders learning from grad students and recent graduates of these programs to see how do you get there, what do you do, what is your day in the life story, I think can be very powerful, again, creating it in the eyes of a middle school student. Next slide, please. The talent to use in this type of video, we want to ensure is diverse in race and ethnic and gender diversity, not only for the interviewers, but also for the providers, so that it is going to hopefully increase the chance that these new learners will grow up and come back to their community, especially if they receive healthcare training from someone that is from their area and that they have grown up with. So I think that incentive is very important. The presentations should be fun. They should be lively. They should be focused on stories as opposed to data at this age. And I think that'll keep their interest piqued a lot better than some of the existing pipeline programs. Next slide, please. In developing this type of video educational tool, strongly encourage a trial run with such a leadership or mentoring group. And there's one called the Y Achievers that the YMCA has and focuses on adolescents and teens in the 6th through 12th grade to learn about career opportunities and educational opportunities. And so running this type of video educational process through that existing group in the local community, I think could get some valuable feedback before we make it available to anyone virtually. There are a lot of kids that are in after-school programs, and I think we can reach a large audience. And again, using a model with this Y program, but also once the video has been vetted and is able to be replicated easily, I think then the process is to make sure it's aware, make sure that the following people are aware of its use. 8th grade teachers, science teachers, coaches, other community partners like the Boys and Girls Clubs, local YMCAs, and church youth groups, I think might be able to use this type of information at that age. And interestingly, also, as we use the PAs as the first model, but providing to the professional associations and societies, such as the Pediatric Society, the PA Society, the Nurse Practitioner Societies, to have that information available for their recent members to help develop in their own community. Of course, it would need to be easily accessible to download in the cloud. And a measurement that we know we would have to do is to include some initial surveys in the initial downloads and maybe even through that model run to get ongoing feedback. And also, I think we could occasionally use surveys just to measure our success, our hopeful success, by monitoring also the number of downloads and taking advantage of those survey responses. Next slide, please. So in summary, we're hoping to strengthen a pipeline structure that is already there and tweak it a little bit and increase the intervention and the age of someone to be involved at middle school level, make it very easily accessible at a very inexpensive cost, if any. Encourage that the information be relatable to the age that is going to be our focus. Also, we think we should broaden the pipeline because the primary care deficit is not going to be filled just with physicians. We need to target the full spectrum of all primary care providers in the pipeline development, and that requires education of young folks before they start their career paths. And then just lay more groundwork for existing pipeline projects to add on to the structure. And I think when we say mind the gap, hopefully we could reduce the gap of information that's out there to assist Dr. Smith, other rural doctors, other folks that are having a hard time getting newly trained primary care providers to come back and even go to these underserved areas. So hopefully this information at an earlier age can improve those percentages. Thank you, and we would be glad to have any questions.
Amazing. Thank you guys so much. I have a quick question and then I want to open it up because I want to make sure people have a chance to ask theirs. So what happens between like an eighth grader, looking at themselves as a potential person who has a career and something like a happy program? Like if we had this program up and running, and I think this is so feasible. One of my favorite parts about this project is it is turnkey, it is able to be done. If you had to think about a step two, how do we get eighth graders? How do we get a minority eighth grader in Holt County to see themselves as the next Dr. Smith?
I think speaking as my older sister and I, we were the first in our family to attend college. And I think the biggest thing for me is to let these kids know that just because you may be the first in your family to go to college, this is something that you can do. Don't automatically assume that this isn't a pathway for you. It may be a little bit harder than if your parents were physicians, but this is something that can be done. This path is not closed. And that also there's many more different opportunities. You don't necessarily have to be a physician. There's a high need for PT, OT, ST, other occupations, that there's a very high need for that. So maybe you don't excel at science, but you can become a great occupational therapist. There is that need. I think the biggest thing is just don't think that this is something that can't be done. I want to give the message that this can be done.
And I just want to piggyback on that. Dr. Keever, I looked yesterday actually at the data to see if is there an age at which we decide what our careers are, right? And there's not. But what the data does tell us is that for kids, it's a process of exploring and then having guidance. And so I think that by starting earlier, we give them those opportunities to explore, and perhaps by showing them individuals that look like them or come from the communities that they come from, it enhances that ability to see themselves in those roles.
Yeah, and my only other comment is I mentioned the Y Achievers program, which really targets that grades 6 through 12 student and exposes them to educational and career opportunities that they may not get otherwise. So collaborating with those type of community programs and adding some of the education and medical information to that, I think could strengthen those programs even more.
I hope everybody's had a chance to read what Chip wrote in the chat, because that's phenomenal. And we have talked about at the Medical Society at this sort of pivotal time in COVID that one of the things that will make us better is partnerships. So Old North State and connecting on some of the work that they're doing about this would be a great next step. Dr. Apollinario, I see you have your hand up.
Quick question. Did you do any research on the data on why some of these pipeline kids are lost? What happens in between after they've had that 8th grade talk or after they've had the mentorships? What happens in between time that convinces them to not go to a rural area or their same hometown and all that? Because we've had a program where we give scholarships to high school students and college students who decide that they want to come to our town. And the biggest factor for us was their spouses when they decided they did not want to live in a rural area or live in the same location that they grew up. We found also that if we work on candidates who have spouses that grew up in the area, then those are more likely to come to us. In fact, we just had someone from Arkansas who grew up in a program in Arkansas, and now we're interviewing him because his wife went to Campbell and that's where they met. And she lived in a 60-mile radius of our location. So that's what's bringing him in, even though they spent all that time and money on him in Arkansas. So I was wondering if there was any data on that.
I don't have any data on that per se, but really appreciate that point and think that that is one of the challenges in getting people into rural communities, even with things like loan repayment programs or scholarships. I agree. I think that's one of the challenges.
I'll highlight a quick success story and then we're going to take a break before our next presentation. I worked in a rural clinic in Rutherford County as a cardiologist. And over the time I was there, I learned very quickly that as I built the practice, if I was going to be successful, I better hire local people. So both my echovascular technologist as well as my nuclear cardiac technologist were local folks who had gone to the high school that was within sight of the practice. And as I learned them over time, there was a funny conversation. They always had a very high tension relationship. And I didn't understand, I mean, they'd known each other their whole lives, right? And then one day it came up that they had worked together before. And I just very naively asked, was like, oh, where did you work? And the answer was at the local sports bar. They had both been bartenders when they went to a community college program that introduced them to their new careers that put them in the top 5% earners in Rutherford County. And so I always think about that. And it did actually not only add great technical quality and services to our rural clinic, but it endorsed us as the place where local people should get their care because people's children and grandchildren work there. And but I think about that and I just, like I said, I kind of, some days would envision them fighting behind the bar, right? Instead of fighting over the, $1 million worth of capital equipment and technical imaging paraphernalia around them. But it's such a transformational story for people in all areas of health professions. And it lifts up communities, right? They can see that. So maybe that is that mentoring that we don't quite have all the data about how do you take an 8th grader and turn them into a successful health professional. But I think we've got to keep learning about that. So thank you guys. Amazing, amazing work. I'm so excited.